Joining me to discuss this unholy mess is Michael O'Brien, Victoria's opposition leader. Thank you so much for your time, Michael O'Brien. What has the government, the Victorian government, done in Melbourne that has actually worked? I mean, masks, stay home, no visitors, and now it wants us to do more of these same failed policies in the rest of the state. What should it do instead?
Good evening, Andrew. Today I've called for Daniel Andrews and Professor Brett Sutton to bring in the experts from the federal government. I don't doubt for a second that Andrews and Sutton have tried their best, but the fact is, with 732 new cases today, their best is not keeping Victorians safe. Their best is not stopping the spread of this virus. What they have tried so far has not worked, obviously. So it's time to look at other opportunities. It's time to get in some people who were very successful in guiding the National Cabinet to get Australia out of lockdown, except for Victoria. This is bigger than Victoria, Andrew. We need help. This is a dark day for our state, and I think it's time for Daniel Andrews to accept that he doesn't have all the answers and to turn for advice to Canberra for those who can help.
Well, all I'm hearing from Canberra at the moment is, yeah, you're doing it, just do more of it. Let me go through some specifics. Would you, if you were Premier, make country people wear masks?
Look, Andrew, if the medical advice is that when you have significant community transmission, that masks will help reduce that, I'm not going to ignore that advice. But what I would say is that we've seen consistent, what appear to be illogical rules produced. And you went through some of them in your editorial, Andrew, and this is confusing Victorians. Why is it okay to go out with all your mates at the pub and sit around the table and drink beers, but you can't have your neighbour over for a cup of tea? I think Victorians see those sorts of rules and they say, that just doesn't make sense. And the risk is, if the leaders don't give rules which make logical sense, some people will choose not to follow them, and that is what we cannot afford to have at the moment.
Yeah, but you seem to be recommending more shutdowns, and that just puts more people out of work. We've gone through one phase already with so much devastation was caused for nothing. Now we've got to do it all over again. The money's not there. I mean, look, for instance, you mentioned the restaurants. The Premier said today restaurants aren't in fact where people tend to get infected. Homes are. At restaurants, you've got staff to supervise social distancing and clean everything, blah, blah, blah. It's at home where they get infected. So should restaurants be allowed to reopen?
Well, Andrew, that's the question I posed in a press conference today. I said, if restaurants are safe, if you don't get coronavirus in restaurants, why are they open in Geelong but not open in Melbourne? I mean, the virus doesn't act differently in a restaurant in Melbourne compared to one down in Geelong. So again, we just see this consistent, illogical, mixed messaging from the government. Look, I think Victorians are prepared to take very serious steps to put a fence around this virus because of the damage that it's doing. But we want to be assured that those steps are going to be practical and effective. And so far, they have not proven to be so.
Did I understand you to say reopen restaurants in Melbourne? Because with the issue is social distancing and hygiene. If you do that at a restaurant, why not open? Is that what I heard you say?
Yeah, well, Andrew, I'm asking the question of Daniel Andrews. Why is it safe to have a restaurant open in Geelong if restaurants are low transmission risks but not in Melbourne? And it is up to the Premier to answer us.
Yeah, but his answer to that might be to go and close the poor restaurants in Geelong next. I'm asking you the same question.
Well,
would you, as Premier, say, look, restaurants can reopen provided they do all these things that we're asking them to do officially already?
Well, Andrew, I'm on the record as having always called for the easing of restrictions where those restrictions make no sense. Now, you might remember during the first lockdown, me and some of my colleagues in the Victorian Liberals, we were pilloried by some in the media because we dared to question some of the restrictions that were in place. We asked, why can't a parent take their child out for a practice drive? Why can't somebody by themselves go and wet a line in a river? Why can't somebody play a bit of golf with social distancing? And we were attacked for that. Now, you notice that this time around in Melbourne's second lockdown, all those three things you are allowed to do.
Because that's exactly correct. You were right.
Because the bans made no sense.
These were useless. Well, not just didn't make any sense. They didn't work. They didn't make any difference to anything. And that's what I'm saying about the restaurants. Right. Can I just be clear? Because I think you said it. you would reopen the restaurants, which I think is right. You would reopen the restaurants in Melbourne, provided they followed social distancing rules.
Well, Andrew, I appreciate you want a very cut and dried answer. What I'm saying is that, yeah, I understand. I understand that, and what I'm saying, I would obviously look. If I was Premier, I would follow the best medical advice. But the questions I would be asking...
working. That's not working. The medical advice, they're always saying, the medical advice is always, oh, look, we want, absolute zero. As a Premier, you've got to also balance the economic advice. And the economic advice is people's lives are being ruined. I've got buildings down here around this joint where I'm sitting now that are shuttered. Some of those restaurants have actually had their fittings taken away. They're out for good. These people have had their livelihoods ripped from them. And now we're told by the Premier, oh, by the way, restaurants aren't really a place of major transmission. Hello?
Yeah. So why isn't Andrews putting his medical advisors to that test? Why isn't he asking them, how can I go out there and tell the public it's safe to have a restaurant open in Geelong, but it's not safe to have one open in Melbourne? That makes no sense. The job of a Premier is to question and challenge the advice to make sure they can make the right call for the public. Now, I don't think Daniel Andrews has been doing that because what he's come out with makes no logical sense.